Welcome back to Out Loud, the Selective Mutism podcast. I'm Chelsea, and today I'm going to be sharing with you our part 2 of our talk with Dr. Stephen Kurtz. If you enjoy it, please go leave us a review and enjoy the episode.
Play therapy. I know a lot of parents we see, they think it's a waste of time. My child goes in there, I'm paying for treatments, and then they're playing a board game. Can you just explain to parents, what's the purpose of play therapy? Those first few visits.
This is a very sensitive topic for me because I've argued that there's no therapy that's more playful than the model that we use. So the question isn't, is play involved in the therapy, but towards what end? Now, you could take a knowledgeable, skilled therapist like Jolene Fernald, who does DIR floor time, which comes more out of the autism world and adapted by her and some others for work with SM. She'll be doing play, but she knows what she's doing in terms of the eventual goal of helping kids in that model get through some developmental stages, but also working on public assignments for parents to do to help kids. So play doesn't, if I know that a child played checkers or spotted or headbands in a therapy session for SM, I have no idea in what way that was used. So I have trouble concluding anything from it. On the other hand, any therapy that's been going on for weeks and months without some obvious gains, parents need to be good consumers and say, maybe this isn't the best fit for my kid. We had a parent come in literally Friday who had already fired my practice. And I invited her to come in because I wanted to know, did we screw up somewhere? And she said, my nephew benefited tremendously from treatment X that you did for condition Y. And we did have every reason to think it would work for our kid. But as you know, every treatment doesn't work for every kid. So I think, as good consumers, she had the right to put it under the microscope and say, this isn't giving us the gains we wanted. They happen to be going a medication route based on believing that there's a biological underpinning to the disorders that they're concerned about. So it's a long-winded answer about play therapy, but undefined play therapy without knowledge about SM doesn't make sense to me. But hearing that there's play in the therapy, like I said, I think our therapy is as playful as anything out there.
So you just probably said this, but say it again to me. How many treatments, as a guide then for parents, how many treatment sessions would you say before a child should have, be verbal or?
I know what your question is. When I was treating a 6-year-old girl years ago, we were at session 26 and I was going to her school early in the morning. Good classic therapy that we do, meeting with the mom and the kid in the classroom before the kids arrived. Kid talks to me fine at the board. We did circle time. We played games. All good. Teacher's on the other side of the room. If the teacher's facing away, the kid is doing fine talking. If the teacher turns 5 degrees towards us, the kid is completely shut down. That's session 26. Something's not right with this therapy if we're up to that many sessions and the kid can't tolerate that. So I went back, scratched my head, met with our colleagues, and we kind of developed a rubric of, within a few sessions, we certainly expect kids to be talking to us with their parent not in the room. By 6 to 8 sessions, we expect to have gone with that kid and made some other changes that they were successful with, either bringing in new people or going to new areas. By 12 sessions, we should definitely have been, in our model, we should be somewhere else with the child talking to us, doing different activities without the parent present. Otherwise, we need to ask why the treatment isn't working like it usually does. That's kind of our guidelines.
And is that specific to your practice, or is that PCIT-SM?
It's specific to PCIT-SM and other. It's not specific to me or that treatment. It's our guidelines in general for the effectiveness of child treatments delivered with parents as agents of change or teachers involved.
Okay. So
I would say the same about OCD, I'd say the same about treating tics. I would say the same about treating depression. I'd say the same about treating ODD or ADHD. If you're 12 sessions in and you're not seeing demonstrable change, I would question the therapy. If you practice out of a psychodynamic, psychoanalytic frame, they would not accept those expectations at all.
Okay, good to know. I just you hear so much in the Facebook pages, the kids have been going for 3 years and they're still not verbal. And I just what's the...
I shake my head every time I read those, every day of the week.
Yeah.
It concerns me a lot.
Yep. All right.
And grasping for straws at CBD oils and things that just have no basis in the science. God forbid I have cancer. I want somebody who's read the journals, knows the evidence base for the treatments, and can go over risk benefits with me.
Mm-hmm. Research shows kids have most success combined, would you say, medication and treatment?
Not necessarily. I think one has to be, again, as a consumer, I think you have to be careful. What's reported as averages for groups may or may not apply to your child. So there are lots and lots of kids we've worked with who have not needed medicine as part of their treatment plan. Mm-hmm. And there's lots and lots of kids we've worked with who've needed medicine as part of their treatment plan. Mm-hmm. And, when you do lectures, you have to do a disclosure slide right after your title slide. You have to show if you have any conflicts of interest. Mm-hmm. You have to disclose that. Like if you get royalties from a book or you're on an honorarium for pharma, something like that. So my disclosure slide is typical Stephen Kurtz. It says, I have no financial disclosures, but I have another disclosure, which is the only thing I really care about is kids getting better and not having impairment. And I'm not a hero. If my board certified behavior therapy doesn't do it, then I definitely want meds to help a kid do the exposure tasks that they find so very difficult.
So parent-child interaction therapy, it's originally used to treat oppositional and defiant behaviors. So can you go into how that was adapted for selective mutism?
Yeah, first let me just say how it got developed initially.
Yeah.
The 1970s, kind of post-World War II, people looking to get more evidence about what therapies were working, and we were having developments in what's called social learning theory and developments in behavioral therapy. And Dr. Iberg was out at Oregon working with some fabulous people. And a few different therapies were developed at the same time that are what we call two-stage therapies. The first stage was developing a positive relationship with the child, with the parent. And then the second stage was limit setting and discipline. So parents had to master skills in the first phase before they were given the green light to practice limit setting and discipline skills. I was well versed in that. I was trained in that. I became a master trainer in that. And that's when I developed PCIT adaptation for SM. I thought we really need the first part. We need relationship building so kids trust and are motivated by us. As you know, as a good ABA person, you're not inherently reinforcing. You do things to be reinforcing, hopefully.
Yep. We call it pairing.
Pairing. There we go. Then we could, with a paired association that was positive for the child with us, we could then start doing graduated exposures towards challenging anxiety exposure tasks. And that really was the thinking behind it, and that was the systematic application of the same type of therapy. I actually had one kid I worked with who presented with me at the Boston conference a few years ago, for whom my presence was a punisher. So for him, after he earned 5 points in school, he would point to the door and I would have to leave.
Yeah.
I'm not especially proud of that, but I do honor that was the nature of the reinforcement paradigm. Yeah.
Definitely been there too.
That's good.
I've also been the other way around where I'm the reinforcer, where the kid gets to hang out with me.
Yeah, it's more fun that way.
Yeah, it's a lot better that way. It feels better.
It feels better.
For me, yeah. So we
Isn't it interesting that the simple act, for example, of saying to the reference librarian, where's the children's section, or the simple act of saying, vanilla when asked what flavor you want. That in one set of circumstances you can do it, and in another set of circumstances you can't. And it may be that the only difference is how reinforcing the person is who's helping you do it and how quickly you will access the reinforcer for doing it. I remember being with a kid on the steps at NYU when she was simply asking somebody, do you like dogs? Or what's your favorite type of dog? And she couldn't do the asking. She had her clipboard, she had her pen, all set to go, and she couldn't do it. And she rehearsed it with me in the room, blah, blah, blah. And then I reached into my pocket and I said, silly me, I forgot your Brave book. And I took out the paper reinforcer. And then she was able to do it. And that's the only difference from 301 and 301 and 10 seconds, her ability to do it. So we tried to be really meticulous with building the relationship and then using good shaping and successive approximations after that.
The SM bot, I was going to go into that. Did you develop that?
Yes.
You and your, okay.
So can I ask, what is the SM bot?
Yes, I take a thing and I bop you over the head. No.
I don't believe you.
No, don't believe it. In PCIT, we do an interesting behavioral observation task, which is we have a kid and a parent play in a room, and the parent follows the child's lead in the play. Then the parent leads the play, and then the parent guides a cleanup. 3 5-minute tasks that we code for the presence and absence of certain key behaviors. My adaptation for the SM bot was have a kid and a parent go in a room and play, have the parent follow the child's lead in the play, see if the parent is at baseline pre-treatment, see how skilled they are at saying thank you for telling me, or repeating back in a non-questioning way what the child says. And then we ask them purposely to go ahead and ask some different types of questions to see if they do better with choice questions, open-ended questions, yes-no questions. And we got a lot of data, and we learned that if you're going to do one and only one thing to help a child, like imagine this, if we had to boil down 80 techniques to only one that you do. I see you shaking your head curiously. It would be to never again ask a yes-no question, which is very hard for people to do. And they try and do it, and then they get mad at themselves, and it's very cute. But it's a learnable skill to avoid yes-no questions because they bring out nodding, they bring out pointing, they bring out gesturing, habits which these kiddos know all too well.
Okay. That's a good tip for all the parents out there.
Yeah.
Is it fair to say that this
gives that alone worked, but that alone, it's what we call necessary but not sufficient.
Yeah. So can the SM bot that establishes like a baseline of verbal interaction, I think I read somewhere that also can show you kind of like a degree of severity of symptoms. Is that true?
Yeah, we could tell how severe and entrenched the behavior pattern is when we do that. It's a pretty good measure of that. It's also a pretty good measure of what we're going to need to do with the parents to help them learn to tolerate distress of their child not responding. So when we send the stranger in as part of this equation, which we do as part of the task, we see how the parent and the child interact with the stranger's presence. Turns out parents, for example, talk lower when a stranger comes in. It's as if they're expecting and colluding with the child to take it down a notch because, we both know this won't be successful, so let's get it over with. You start whispering to me and I'll interpret for you. And I say that with a smile and with all due respect to the fact that this habit takes on a life of its own. I don't say that with any sense of being judgmental or.
Can you see my face?
I think you're behind the microphone.
I'm just thinking, like, as a mom, I am guilty of that, and I think I probably still maybe even do that sometimes. But from my mind, what I'm doing is not speaking for her. I'm still speaking, but I'm trying to like downplay my role so she can step forward.
And there are effective ways to do that. For example, if you say to a child, you could practice telling me and then she'll ask you again, that's a good strategy. But most people, nobody would know to do that without somebody teaching them.
Okay.
And the first couple of times it happens, you have no idea what you're about to get into. Lady comes up in the supermarket in aisle 3 and says, "Hi, sweetie, whose class are you in this year?" and you say, she's shy, she's in Miss Jones's class, you have no idea what you're about to get into as a repeated habit.
Mm-hmm. Like with PCIT, what I really like is you're also teaching the parents skills, and that's great because that helps with generalization. And I'm just wondering, do you ever see, I'm sure you do, parents who feel like they're to blame, or do they feel like they're being criticized for how they're interacting with their kids?
The answer is absolutely yes. So another thing I do with every family that I meet is I make them raise their hand. So you and I can see each other. Podcast, of course, they're only going to hear this. But
Yeah.
Go ahead and raise your hand and repeat after me. I promise
I promise.
I will not beat myself up
I will not beat myself up
over past mistakes,
over
past mistakes.
because Lord knows
Lord knows.
I did the best I could with what I knew at the time.
I did the
I
best
did the best I could with what I knew at the time.
And once you take that pledge, then
Yeah.
we're good to go. You got to kind of forgive yourself. I've never met a parent who wanted this for their child. So, but I think it's important to recognize that yes, you did some things that backfired, but who knew?
But that's just normal reactions to that.
It is normal reactions.
Like,
I know when Chelsea was little, I remember the specific day. She was 3 years old, and we were laying in on her bed, on our bellies, looking at a book, and it was the Bernstein Bears. And it was all about stranger danger. So, I thought I was doing a good thing. It was my duty to warn her,
it
to
was
take
the
away
90s.
And she was terrified of that book. I never should have brought that book out. And I mean, yes, she was anxious before it and all that, but I remember I'm bringing it up now, and it's 25 years later. That, I don't know. It was just an anxiety-provoking book, and I wished I had never done it because I did see after that.
But the alternative would be not preparing her for stranger danger, right? So you're in a tough spot.
Yeah, I know.
Probably over-prepared.
It's just tough. It's tough as a mom.
Yeah. You forgot to pick up the manual when you left the hospital with her, right?
Yeah.
So let's see. We'll get into. So the first phase of PCIT would be child-directed interactions.
Yes.
Oh, I know we're kind of like rehashing everything, but it's good to hear it directly from you. So I kind of saw this a little bit when I was volunteering. It's child-directed, so there's no prompts to speak. It's kind of just rapport building.
Yes, exactly.
What that looks like. Do you always start out with that, no matter what client you get?
I always start out with that no matter what client I get. And I try to make it, for example, on the camp days, that all the staff start out with that until they have reason to think that the child is ready for more. So if the child is spontaneous with them, that's a pretty good indication that they're ready to have a back and forth. But we like to give a warm-up period for sure.
Mm-hmm. How do we skip over this? The kind of like fading out parents and the whole part where you're using like an earpiece and you're directing the parent's interaction with the kids.
So typically the parent and child are playing together in a preferred activity. If I'm doing an intensive and going to somebody's home, I typically like them working on some craft activity when I get there. So I remember doing it with a 6-year-old girl, and it was Christmas time, and they were building a gingerbread house. Mm-hmm. And I remember going to some other kid's house last year, and he was really into drawing. So they were just sitting at the table doing drawing together. With that, we then try to fade ourselves into that interaction, just using rapport building skills, which means we purposely avoid all questions or prompts to speak. And what it sounds like is a really good grandparent or aunt or uncle who's not trying to get the kid to perform in any way, but just hanging out with them, following their lead in their games, and hopefully it's games they find enjoyable. Mm-hmm. And then the kid gets a sense of your rhythms. They get a sense of how loud you are, how quick you are, how funny you are, how you kind of move, and it lets them feel a bit safer, and then maybe ready to take your hand in trying an exposure, like answering a question. And then the skill, when we shift over to the verbal directed, is to make sure that the question reflects things that the kid is naturally interested in.
Mm-hmm.
I saw a report card today for the kid I'm going to work with in Spain, and he got significantly above average in math and significantly below average in everything else. You could be sure the first academic task I'm going to do with him when I get there is a math test.
Mm-hmm.
Now, I happen to know him already, and we played card games, so I knew he was really good in math as well, so that wasn't a surprise.
I can see it being kind of difficult for some people who aren't like really experienced therapists, like knowing when to move from child directed to verbal directed. So I was wondering, do you have any tips for that?
My tips are that in the presence of somebody else the child is already talking to, if they're answering 80% of their questions without wetting themselves, hitting the parent, if things are going okay, and they're answering like 4 out of 5 questions, then I'm ready to come closer to their interaction and give a try at asking a good question.
Mm-hmm. Okay.
And also, if the child is spontaneous in front of me, then it's a good indication that they may be ready for me to ask them a question as well. Again, these are guidelines, not rules, so you can't take it to the bank and you can't sue me if it doesn't work out.
Yeah. I mean, if, say you moved ahead too quickly, what are the consequences of that?
So I think that's a really, really key question. If you move ahead too quickly, how do you rebound? So we talk about always having a plan B, and that means going back to the last thing the child was successful at and regaining behavioral momentum. So going back to the last thing. Or if the task was tell the lady whether you want a cup or a cone, and the kid thought they were ready for it, but then they panic or they can't do it. Panic is an interpretive word. Mm-hmm. If they can't do it, we could go 5 steps away and say, let's practice again. Cup or cone, sprinkles, no sprinkles, rainbow sprinkles, chocolate sprinkles, and we can inch closer. So it's having the confidence to go back and lower the task. But in all cases, it's the adult's responsibility to communicate to the child, silly me, I picked the task that was too hard for you just yet. Otherwise, the kid feels bad, they feel guilty, they might feel like they're in trouble. So I always take the hit on choosing the wrong goal.
Mm-hmm.
Always.
That's important, I think.
It's really important. Mm-hmm. And, as a supervisor and a manager, it's interesting if you go about your business assuming if something didn't go right that you may not have set people up for success in the right way and may not train them in the right way, rather than assuming they were lazy, bad, or stupid.
Mm-hmm.
You're just a wealth of information.
I know, I could talk.
I do tend to get excited about this.
Talk about this forever.
And I have been doing it a while, so hopefully I earned my seat at the table, I guess.
So I wanted to talk about exposures and when can you start doing these? And how exactly can you explain it for families to start doing on their own?
You, again, tapped into one of my favorite things. I think that exposures is something that have to be done all the time. We talk about an exposure lifestyle. And the definition of an exposure is, for me, prompting a child to do something that's slightly out of their usual and customary. So for me, to prompt my wife to order a Diet Coke with lemon when we go to a restaurant, that's not an exposure because it's predetermined she's going to do that anyway, whether I prompt it or not.
Mm-hmm.
Yeah.
So an exposure by definition is something that's slightly outside the child's comfort zone. Actually, that's a good exposure. An exposure is something that's outside of the comfort zone. A good exposure is something that's slightly outside the comfort zone. So if you've never ordered in a restaurant before, and you've never even said your order to me with the waiter standing there, it's ridiculous to think that you're going to order for yourself with the waiter.
Mm-hmm.
It may be realistic that the waiter is there and you say, sweetie, practice with me. Did you want the hamburger or the cheeseburger today? And you've already kind of rehearsed that before you got there. That's an exposure. It's systematically rehearsing and identifying and rehearsing, and then in the actual situation, giving a go at using the new skill. Yeah, you guys ever hear about Vygotsky?
I have not.
Oh, we're going to get all philosophical on you. Now, you can't get Vygotsky as a guest because he died, I think, in 1934 or so.
You can take his place.
He was a Russian philosopher, psychologist. He talks about zones of proximal development. I'll give you what I think is a good 30-second summary, maybe even 15 seconds. There's what you can do without assistance. There's what you can do with assistance. And there's what you couldn't do even with assistance. Mm-hmm. So we're just trying to push the things that a child can do with a little bit of assistance, just kind of enter into that territory as often as we can with support. And eventually they'll do it, and then they'll do it with less difficulty. I think experientially it takes kids about 7 times of doing something in close order, not before it's easy, but before they define it as doable. So saying your name when they do roll call, ordering in a restaurant. I think if you get 7 of those kind of in close proximity, you start to get a little bit of self-efficacy, the belief that you can actually do it, but not that it's easy.
Yeah. So that sounds, as a mom, that sounds like the reward chart, sticker chart. Like we used to make goals up for Chelsea each week and then practice it for the week and go back in and do the report. Do you use sticker charts with your clients?
Sure.
Yeah. So the moms they have homework.
Yes.
Kids.
We couldn't do this work without caregivers being trained. I wouldn't expect generalization of gains at all without that.
And teachers, right?
Yes, and teachers.
Or an adaptation of teacher-child interaction therapy. But is that kind of the same?
There is. And there, we're usually not partnering with the teacher who, at the same time we're working with the parent.
Okay.
Sometimes we do clinically. But with this work with selective mutism, we would be out of our minds if we didn't plan for who is it that's going to go to school and help the kid use these skills in the school setting. Mm-hmm. Sometimes it's us, sometimes it's the parent, sometimes it's the teacher. Depends who's interested, who's available, whether the kid needs the parent to be there first and then pass the baton to somebody in school.
Yeah. Any tips for parents where they say the school just will not engage? We see that a lot online. Parents just say the schools would not allow them in there early or after, or they say they don't have time for it, which is kind of understanding in some regard, schools today, public school. I don't know. Any tips, though, if they're just getting resistance from the school?
I don't think I honestly have any tips that would apply across the board. When I hear this individually, I just have to do my detective work to figure out who I can partner with, because as a parent, as a therapist, I can't afford to have a blanket no. Mm-hmm. So I try and figure out who to partner with. I recently was treating a 13-year-old girl in Ireland for the whole week, spending the entire week in school with her, and her 3 best friends who are my co-therapists. I love them all dearly. They all got certificates at the end of the week. But before I went over, the school was concerned about it's just weird to have somebody come in school and be with kids.
Right, like a disruption to class.
They're concerned about child abuse.
Oh, okay.
How do you? I mean, I know that I'm a good citizen. You don't know that.
I was thinking more as a kid with SM, I would be very embarrassed that I have someone with me.
Of course. And we happened to work it out, I think, by including her friends. Mm-hmm. It worked out brilliantly. Actually, just this morning, I happened to see some photographs of me on the day before we went to school. I went with her friends to mini golf and bowling and to the arcade. And we just have a lot of fun, goofy pictures of us all together. So they were actually like showing me off. They weren't trying to hide me. It was kind of... Anyway, the school said you can come, but the only room we'll allow you in is the room next to the principal's office. It's our boardroom because we can see in it. I thought, no problem. Okay. They actually said we need to have somebody in the room with you. And I thought, if they have somebody in the room with me, and if the kid shuts down because of that, and if I have flown 5,000 miles to get there, we'll figure it out.
Yeah. That's
But
amazing, though.
for example, when I'm going to Spain, they gave me a bunch of rules, and it's more rules than I want, but I still have enough flexibility to be able to get the job done, I think. So again, I don't have any blanket advice other than stay patient and try to figure out what is the actual barrier. Is it the amount of time you're asking me to do? Is it the skills that I don't have? Because sometimes that can be fluid, and you can work with that and kind of modify the expectation about what the actual barrier is.
Mm.
I'm going to say a little bit more about exposure. Like, how do you keep a kid successful? And I guess we already talked about if an exposure is unsuccessful, you kind of go back to where the last point they were successful. But I don't know. What am I trying to think? Oh, I'm trying to think about how you explain generalization. So only changing one variable at a time. I was hoping you could explain that a little bit more.
If I'm with a 6-year-old and we're playing Headband, Spot It, and Monopoly Junior in my office, and if it's going well with the parent there, I could get rid of the parent, go to another room, and get 4 new games. Mm-hmm. And the kid might be able to tolerate all that. Of course, I wouldn't bet that they would, but they might. If I want to increase the chances of it being successful, then I would just have the mom inch out, or I would take the mom, the kid, those 4 games, and me, and go to the different room together, or I would swap out one of the different games in the same room with the mom still there, to minimize the chance that I'm changing too much at once. Mm-hmm. Probably back in 2002 or 3, when I was kind of developing this, probably I got burned by doing that. And then probably I scratched my head and said, how did I screw up this time? And maybe that's when I said, oh, I know. Why don't we change one variable at a time? So in the end, you will be changing the location. In the end, you will be changing the people in the equation. And in the end, you will be changing the activities. But the word to the wise is you maximize the chance of success by only changing one at a time. And that's served us very, very well.
Yeah, I think it's really genius. But then I'm confused about how you would go about this in a classroom where obviously there's like a lot of kids to fade in. Like, is it possible to kind of accelerate that process and like you don't have to fade one classmate in at a time?
I'd say it's possible, and that proves to be the case for a lot of kids. I do remember twins I was treating, and the boy was a bit more impaired than the girl. He just graduated high school. He's off to college, so this was a long time ago, in 2nd grade. And he said, I need to talk in front of everybody before I can just talk to my friends. And so I remember the red piece of construction paper that we wrote down every kid's name and just checked off that he talked in front of them. And that's what he felt like he needed. But that's not typically the case. Uh-huh. But it is typically the case that I'm going to go with 3 games I did in my office and literally bring those same 3 games to the kids' school. I did that with the cash register and the ice cream, the Melissa and Doug ice cream a couple of weeks ago. And I was really glad I did, because as soon as the kid sees me come in with that cash register and that ice cream set, it's a learned association, a Pavlovian kind of conditioning that brings out it evokes that same talking behavior that he associates with me and those toys from a different setting. Yeah. But in the end, you're going to change all 3 variables anyway.
Mm-hmm. It's interesting. Like for me personally, I never had PCIT, but I always found it easier, which is weird because making presentations was one of the hardest things, but I would do presentations where I hadn't talked to everyone in my class before, but doing that showed them that I do talk, and that kind of breaks the ice for the whole class in one act, which is interesting. Yeah.
Yeah, I've seen that as well. It breaks the I know that you know that I know that I actually talk.
Yeah, like even if it's not a direct conversation with your classmate.
Yes, it's proof positive.
Yeah.
Chelsea does in fact speak.
Yeah. It's good.
I remember being with a kid once and doing pull out in the OT room or something with a friend for the first time. And the kid looks at me and he says, he talks. I said, I know he talks. You like how he talks? He said, yes. I said, so tell him. He says, Michael, I like how you talk. And then they went on and played.
Oh, that's cute.
Aw.
That's great.
Yeah, kids are always shocked.
Well, they have good reason to be shocked.
I know. It's just
That's cute.
If all of a sudden I got up and went into a great tap dance, with like top hat cane, you'd say, "Oh my God, he tap dances."
I didn't know he did that.
Yeah, it's true, right? Like, yeah.
You only
Makes perfect sense. Do you ever have parents? I guess by the time they probably get to you, they're on the same page, I would think. But I know a lot of times, parents aren't on the same page. I find that usually it's the dads that don't really buy into the whole SM thing. I don't know. I guess, do you find by the time they get to you, they're both in agreement that there's an issue and they need treatment? But did you ever hear, parents?
Yes, by the time they get to me, they're in agreement that there's a problem. Usually, they're not always in agreement about what the steps are, especially when it comes to potentially the role of adding medicine. That becomes something that separates folks quite a bit. Good therapists work hard to get both parents, or if there's more than two parents, good therapists work hard to get everybody involved from the start and not take it as an assumption if one parent is in the room and the other, let's say, is at an outside job, not to assume that means anything. It doesn't mean agreement or disagreement, but you really, especially for that first session, we'd like to get both caregivers in.
So back to the, just before we finish up, we could sit here all day.
We're almost done.
So it's kind of true what you were saying. I know I've said in the podcast before, I have my son who has ADHD actually, and then Chelsea who had SM. And being the girl with SM, she was always the, should I say, better behaved child, quiet, whatever. But in talking with you today, it's brought back a lot of, I forgot about the oppositional kind of behaviors. And I think that those were what caused her dad and me to differ, because he did see it as her being very oppositional, choosing to not answer, choosing to not listen to him. So he would punish, and then that caused friction between us because I was like, she can't, you shouldn't be punishing her for that.
Sure.
So it's just reminding me about the oppositional behaviors and, being at school all day and not speaking all day and then coming home and letting loose with tantrums and, crying and whining and throwing yourself on the floor and all that. So how do you separate that SM? What part of the relationship between the two, or is it a separate thing? Is it all one thing? How do you separate that?
So it's a little bit of a complicated relationship. Here are some interesting considerations. We understand the fight-flight response. So you guys have been very well behaved. If we were in my office on the 10th floor and I attempted to throw you out the window, I don't think you'd stay so well behaved. Your nice New Hampshire politeness would disappear
pretty quickly.
You would scratch. Yeah, I mean, you would do what you got to do to protect yourself. Mm-hmm. So when the behavior that's being described as oppositional is almost exclusively in the context of people being pushed to talk when they're not comfortable enough to do it, that to me is not oppositional behavior. That's fight or flight.
Mm-hmm. Okay.
And this is not black and white, all or none, right? So Chelsea, although she was probably a very, very nice, cooperative young girl, probably sometimes she could be oppositional, having nothing to do with anxiety. So it's a matter of sitting with a therapist who helps you think through the relative amounts of this. If, on the other hand, I say to a parent, in situations where there's no speaking expected, is she still an oppositional little brat? And the answer is yes, then that's an oppositional problem independent of the anxiety.
Okay.
And that's usually not so hard for parents to tease out for you. You just ask them to imagine situations where talking isn't expected. I can't get her to bring the dishes to the table. She's got an excuse for this, that, and the other. She breaks her brother's toys just to get back at him after he's rude to her. That's different and has nothing to do with selective mutism. So we try and help people understand the behavior. If it's in the context of avoiding an anxiety-provoking situation, then we don't think of it as oppositional. We think of it as fight, flight, or freeze.
Okay, thanks. It's a good way to look at it for parents, I think, to kind of tease that out.
Yeah. I had one last question, which I think I already know the answer to, but I just wanted to bring it up. So do you focus at all on increasing eye contact or voice volume? And what is your thoughts on that?
I'm what you call an outlier on this. That I have my opinions and a lot of people disagree. So I think that eye contact is the last thing we have to regulate the intensity of an interaction. It's like fine tuning on an old radio dial. Eye contact always, in my experience, comes later with more comfort in the interaction. And I find if I don't command it or make it its own contingency, that it self-corrects on its own. But let's take worst case scenario. You have a selectively mute kid. He's not talking to teachers, not talking to peers, not talking to some important relatives in their life. And then the kid is able to do that. And the only thing that he throws out as a problem is that he doesn't do good eye contact. You're going to still bless me. You're going to ask me, what foundation you can donate money to.
Yeah.
You'll be very happy. So I don't worry about that. Now, voice volume is another tricky one.
Mm-hmm.
I've learned through enough clinical cases I've done not to worry about whispering. Every kid who's ever been a chronic whisperer with me, has eventually gone to regular voice, full voice talking. One of my favorite examples is a kid who he was in the Hear Our Voices panel at the Boston Selective Mutism Conference. And he talked about being a chronic whisperer and appreciating that there was no pressure because eventually his regular voice came around. By the way, if you ask speech language pathologists, they will remind you that whispering and voicing are completely different muscular arrangements. And whispering is actually harder on the body than regular voice talking. It's harder to whisper loud than to talk soft.
Yeah.
And here's what happens with most people when they whisper, if you try and get them to, quote unquote, use a regular voice or a full voice. Usually they'll just whisper louder.
Yeah, that's true. Yeah.
So I tend to focus on it less than other treating providers that I know.
So you don't tend to see people or kids that are kind of stuck whispering. I've always found that
Never have I had a kid who got better except that he still whispers.
I remember once I started talking, I was always frustrated because people would still say, like, I can't hear her, or like, I can barely hear you, you're whispering.
And then she wouldn't repeat herself.
But it felt like I was being so loud and like.
Oh, yes.
Yeah.
Oh, there's a great lady who's not in the SM circuit anymore. Her name is Audrey Boggs. She was in the SM world professionally before I was, and she tells of an anecdote of getting in trouble in school when she thought she was yelling, and in fact she was only whispering, but she thought she was yelling.
Okay.
Those are my questions.
I can't thank you. And we were, we'll fess up. I think Chelsea, she'll probably be mad at me for saying this, but I think there was some anxiety.
You can always edit it out. It's too bad.
There was some anxiety surfacing over this interview. It was like the most coveted, we kept talking about Dr. Kurtz, but we never dreamt that you would agree or that we would even could ask you to come on this little podcast of ours.
I think I gave Chelsea some grief by email why she didn't contact me. Yeah,
because we did a whole episode on your PCITSM, but it never crossed my mind to reach out to you and ask you to talk to us.
It's fun to connect with you guys again, and I'm glad to share the time, believe me.
We can't tell you how thankful we are to have you come on. We truly appreciate you giving up your time to come on and talk with us.
My pleasure.
You need to write a mom book.
A mom book?
I need to write a mom book.
Like in mom language?
Just, Yeah.
What do you
The,
mean?
the book that I never picked up at the hospital for SM kids, right?
Oh, a
That's
handbook.
handbook.
Yeah. Yeah. So thank you so much. Maybe down the road we can do a part 2.
No way to find me.
Yeah. All right.
Okay. Want to say anything to Dr. Kurtz?
I don't know. I mean, thank you so much. Oh man, I have another question about your PCIT training. Like, how could I get involved in that if I wanted to be
Oh, yeah.
certified?
So folks who want to find out about trainings should just email me. You can put that in the show notes, I guess.
Okay.
But it's skurtz, SKURTZ at kurtzpsychology.com. And we'll be posting trainings there. And we keep a very extensive mailing list. So if folks want to find out about future trainings, we're happy to make that available. We're doing 2 kinds of training. One is a 2-day intensive limited to a ratio of 6 to 1, so that there's plenty of time for skills practice.
Mm-hmm.
Then also the option of continuation for certification, which is getting to review some tapes over the course of a year and make sure that people are able to apply it in clinical practice.
Wow.
Okay, and before we let you go, I'll just again give out your website.
KURTZpsychology.com and selectivemutismlearning.org, all one word.
Okay, and Kurtz is Kurtz. And then did you say also you were having, is it a Facebook Live event coming up?
Yes, next Saturday on the 29th. Yep. So if folks look on our webpage on Facebook, our Facebook page, I guess, they'll have access to that. And those things are automatically recorded as well. But if you're in the New Jersey area, it's in Morris Town Library.
Okay, that's wonderful.
Great.
Yeah.
Good. Yes, that's a great event. So that's open to anyone. Just sign on and anyone can have access to that. Super. Okay.
All right. Thank you.
Okay, well, thank you so much.